NLN Pre-Nursing Entrance Exam Practice Questions. Question 1. Which dose volume gives 600 mg from a supply of 200 mg per 2 ml in this study plan item? Option A is 0.33 ml. Option B, 3 ml. Option C, 12 ml. Option D, 6 ml. The correct answer is option. Set up the proportion 200 mg, 2 ml equals 600 mg x ml, so x equals 600 times 2, divided by 200 equals 6 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 2. During a quick next review of a review checklist item, which word is closest in meaning to evaluate in a science paragraph? Option A, deliver. Option B, ignore. Option C, cover. Option D, judge. The correct answer is option. Evaluate means judge, so that choice matches the meaning in context. Deliver means bring, not judge, ignore means disregard, not judge, and cover means place over, not judge. Question 3. After checking the choices in a common mistake item, which answer identifies the substance dissolved in a solution? Option A, precipitate. Option B, solute. Option C, solvent. Option D, catalyst. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, solvent does the dissolving, and catalyst speeds a reaction. Question 4. If a calculator-free STEM gives one clear clue, which inference is best supported by the passage, a volunteer program grew after former patients shared personal stories at orientation? Option A, orientation should never include stories. Option B, personal stories can motivate people to participate. Option C, former patients stopped the program. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage, former patients stopped the program, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 5. When time is limited on a patient chart question, which answer identifies the group that does not receive the experimental treatment? Option A, a conclusion. Option B, a sample. Option C, experimental group. Option D, a control group. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation, sample is the participants or items studied, and experimental group receives the treatment. Question 6. Given the information in a lab result item, which average results from scores of 60, 64, and 68? Option A, 64. Option B, 192. Option C, 62. Option D, 8. The correct answer is option. Add the 3 scores to get 192, then divide by 3 to get 64. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 7. Suppose a similar health literacy item appears on test day. Which word is closest in meaning to impartial in a science paragraph? Option A, fair. Option B, biased. Option C, fragile. Option D, distant. The correct answer is option. Impartial means fair, so that choice matches the meaning in context. Biased means unfairly one-sided, not fair. Fragile means easily broken, not fair. And distant means far, not fair. Question 8. While working through a timed safety protocol set, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, radiation. Option C, evaporation. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 9. Before choosing an answer in a concept map item, which inference is best supported by the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, quiet rooms increase noise. Option B, distractions are always helpful. Option C, reducing distractions can improve study conditions. Option D, students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Quiet rooms increase noise, is not supported by the passage, distractions are always helpful, is not supported by the passage, and students no longer needed to study, is not supported by the passage. Question 10. A student sees this hydration log idea on a next review. Which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A, higher scores prove every student studied more. Option B, the conclusion may be too strong because another factor could explain the scores. Option C, random assignment is never useful. Option D, the conclusion should ignore group differences. The correct answer is option. Without random assignment, group differences may affect the result. Higher scores prove every student studied more does not follow from the situation, random assignment is never useful does not follow from the situation, and the conclusion should ignore group differences does not follow from the situation. Question 11. One vital signs practice problem tests this skill, which for flow rate delivers 1L over 6 hours using a 60 GTT/ml set? Option A, 10,000 GTT/min. Option B, 172 GTT/min. Option C, 3 GTT/min. Option D, 167 GTT/min. The correct answer is option. Convert 1L to 1000 ml, then use 1000 times 60 divided by 6 times 60 to get about 167 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 12. Several choices look tempting in a cell energy item. Which word is closest in meaning to monitor in a science paragraph? Option A, to neglect. Option B, paint. Option C, observe. Option D, debate. The correct answer is option. Monitor means observe, so that choice matches the meaning in context. Neglect means fail to care for, not observe. Paint means apply color, not observe. And debate means argue, not observe. Question 13. For this patient teaching nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, bias. Option B, estimation. Option C, classification. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Bias is a systematic error, estimation is an approximate calculation, and classification is grouping items. Question 14. In a short dosage label practice stem, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, a training may have improved compliance with hygiene practices. Option B, a training increased infection rates. Option C, hand hygiene cannot affect infection. Option D, the refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage, hand hygiene cannot affect infection is not supported by the passage, and the refresher removed all risk permanently is not supported by the passage. Question 15. Among the choices in an infection control item, which increase is shown from Monday 13 to Wednesday 23 in a simple practice chart? Option A, 10. Option B, 36. Option C, 7. Option D, 23. The correct answer is option. The increase is the final value minus the starting value, 2313 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 16. Using the facts in a fall prevention question, which value of x solves 3x plus 4 equals 16? Option A, 5. Option B, 4. Option C, 12. Option D, 3. The correct answer is option. Subtract 4 from both sides to get 3x equals 12, then divide by 3 to find x equals 4. The other choices result from stopping after subtraction, adding 1 too many, or not reversing the operations in the equation. Question 17. Based on the clue in a nutrition note item, which word is closest in meaning to predict in a science paragraph? Option A, remember. Option B, repair. Option C, borrow. Option D, forecast. The correct answer is option. Predict means forecast, so that choice matches the meaning in context. Remember means recall the past, not forecast. Repair means fix, not forecast. And borrow means take temporarily, not forecast. Question 18. Consider this high-yield oxygen exchange concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, a vein. Option B, artery. Option C, a trachea. Option D, capillary. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Vein returns blood to the heart, artery moves blood away from the heart, and trachea carries air. Question 19. Near the end of a study schedule review session, which inference is best supported by the passage, a clinic sends appointment reminders, and missed visits decline? Option A, reminders can help patients remember appointments. Option B, reminders caused more missed visits. Option C, patients cannot benefit from reminders. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage. And appointments no longer need scheduling is not supported by the passage. Question 20. Across similar lab safety nursing entrance questions, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, convection. Option C, conduction. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves. Convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 21. Since only one choice fits the blood flow clue, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart? Option A, 10. Option B, 5. Option C, 29. Option D, 48. The correct answer is option. The increase is the final value minus the starting value, 2919 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 22. From the information in a kidney function item, which word is closest in meaning to relevant in a science paragraph? Option A, heavy. Option B, unrelated. Option C, ancient. Option D, related. The correct answer is option. Relevant means related, so that choice matches the meaning in context. Heavy means weighty, not related. Unrelated means not connected, not related. And ancient means very old, not related. Question 23. At a testing desk during an immune response review, which answer identifies the organ that produces bile? Option A, liver. Option B, gallbladder. Option C, kidney. Option D, pancreas. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, kidney filters blood, and pancreas secretes enzymes and hormones. Question 24. Inside a medication math science or skills item, which inference is best supported by the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. The exam has no time pressure. Option B. Timed sets remove all content gaps. Option C, comfort never changes with practice. Option D, timed practice can build exam familiarity. The correct answer is option. The passage connects timed practice with increased comfort. The exam has no time pressure is not supported by the passage, timed sets remove all content gaps is not supported by the passage, and comfort never changes with practice is not supported by the passage. Question 25. Through careful reading of a reading passage stem, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the stem. Option A. The longest answer is automatically best. Option B. Any true statement is always best. Option C. The first familiar term should be chosen. Option D. The choice that directly answers the stem should be selected. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation, any true statement is always best, does not follow from the situation, and the first familiar term should be chosen, does not follow from the situation.